Why medical bills in the US are so expensive. The pressure on our sprawling healthcare system in the US has never been greater. Massive federal cash influxes have sought to shore up hospitals sagging under the weight of the testing and treatment burden and the related temporary cessation of elective surgery and regular medical care. Long before this crisis, the US led other industrialized nations in high spending on healthcare and getting a low bang for the buck in terms of health outcomes and the percentage of the population served. As of 2020, life expectancy in the US, for example, is 77 years, while it ranges from 80.7 to 83.9 in 10 other high-income countries. And only 91.4% of the population in the US has health insurance, compared to 99% to 100% of the population in the other industrialized countries examined. Costly healthcare hurts everyone. The high cost of healthcare affects everyone, sick or well. It has depressed individual spending power for the past few decades. Salaries for American workers have risen, but net pay has stayed the same because of increasing charges for health insurance. Today, tightening up on overspending is urgent to help stretch medical and hospital resources to deal with the pressure on the overall system. 1. Multiple systems create waste. Administrative costs are frequently cited as a cause for excess medical spending. The US spends about 8% of its healthcare dollar on administrative costs, compared to 1% to 3% in the 10 other countries the JAMA study looked at. The US healthcare system is extremely complex, with separate rules, funding, enrollment dates, and out-of-pocket costs for employer-based insurance, private insurance from healthcare.gov, Medicaid, and Medicare, in all its many pieces. In each of these sectors, consumers must choose among several tiers of coverage: high-deductible plans, managed care plans, HMOs and PPOs, and fee-for-service systems. These plans may or may not include pharmaceutical drug insurance, which has its own tiers of coverage, deductibles, and co-pays or co-insurance. For providers, this means dealing with myriad regulations about usage, coding, and billing. And, in fact, these activities make up the largest share of administrative costs. 2. Drug costs are rising. On average, Americans shell out almost twice as much for pharmaceutical drugs as citizens of other industrialized countries pay. High drug prices are the single biggest area of overspending in the US compared to Europe, where drug prices are government regulated, often based on the clinical benefit of the medication. With little regulation of drug prices, the US spends an average of $1,443 per person, compared to $749, on average, spent by the other prosperous countries studied. Drug prices in the US are 256% of those in comparison countries. In the US, private insurers can negotiate drug prices with manufacturers, often through the services of pharmacy benefit managers. However, Medicare, which pays for a hefty percentage of the national drug costs, is not permitted to negotiate prices with manufacturers. 3. Doctors and nurses are paid more. The average U.S. family doctor earns $214,370 a year as of 2020, and specialists make $316,000, way above the average in other industrialized countries. American nurses make considerably more than elsewhere, too. The average salary for a U.S. nurse is about $74,250, compared to $58,041 in Switzerland and $60,253 in the Netherlands. U.S. managed care plans, HMOs and PPOs, may succeed in lowering healthcare costs by requiring prior authorization for seeing a high-priced specialist. The use of a nurse practitioner instead of a family doctor can also save money. 4. Hospitals are profit centers. Hospital care accounts for 31% of the nation's healthcare costs. Between 2007 and 2014, prices for inpatient and outpatient hospital care rose much faster than physician prices, according to a 2019 study in Health Affairs. Hospital expenditures grew 6.4% in 2020 to $1.27 trillion. U.S. prices for surgical procedures in hospitals greatly exceed those of other countries. A typical angioplasty to open a blocked blood vessel, for example, costs $6,390 in the Netherlands, $7,370 in Switzerland, and $32,230 in the U.S. Similarly, a heart bypass operation in the U.S. costs $78,100 compared to $32,010 in Switzerland. Today, many hospitals are on the brink financially. What's more, the cessation of elective surgery and severely declining provider visits because of the coronavirus lockdown account for a big part of the decline in the overall economy. 5. U.S. healthcare practices defensive medicine. Both physicians and hospitals have an interest in preventing lawsuits, so just-in-case tests and scans may be ordered. And these tests can be costly. While a CT scan costs just $97 in Canada and $500 in Australia, the average cost is $896 in the US. A typical MRI scan costs $1,420 in the US, but around $450 in Britain. Researchers have concluded that it's not the sheer number of tests and procedures but their high price that explains why it's so expensive to be sick in the US. 6. US prices vary wildly. Because of the complexity of the system and the lack of any set prices for medical services, providers are free to charge what the market will bear. The amount paid for the same healthcare service can vary significantly depending on the payer, i.e. private insurance or government programs, such as Medicare or Medicaid, and geographical area. The bottom line: most other developed countries control costs, in part, by having the government play a stronger role in negotiating prices for healthcare. Their healthcare systems don't require the high administrative costs that drive up pricing in the US. As the global overseers of their country's systems, these governments have the ability to negotiate lower drug, medical equipment, and hospital costs. They can influence the treatments used and patients' ability to go to specialists or seek more expensive treatments. Consumers may have fewer choices, but costs are controlled. In the US, a lack of political support has prevented the government from taking a larger role in controlling healthcare costs. The Affordable Care Act focused on ensuring access to healthcare but maintained the status quo to encourage competition among insurers and healthcare providers. Now that the costs related to the healthcare crisis of 2020 and 2021 threaten to swamp both the healthcare system and government budgets, the time for change may be at hand. In the meantime, it's important for each person to do their research so that they can find the best health insurance company to suit their needs.